My name is Marina Franco with the Houston Recovery Center, and today we're going to be speaking to Dr. Crystal Collier. Hello, Dr. Collier. Thank you for spending some time with us today.
Absolutely. Thanks for having me.
Can you tell me a little about yourself and what you do?
Sure. I am a therapist. I have a master's degree in clinical psychology and a doctorate in counselor education. So I've been a therapist for about 20 years and a counselor educator for probably about the past 10 years. I teach at a couple different universities in town and do research in addiction.
Okay. Can you tell me why you do what you do?
Sure, that's a great question. I have a pretty personal passion for this work. I am a person in long-term recovery. I started using drugs and alcohol when I was about 12, and by the time I was 16, I was an intravenous drug user. Dropped out of school. I did make it back, but just barely because of an overdose. And I got sober at about 18 years old, and things were pretty good for a while, but my shame and guilt crept back in, even in early recovery. So I started studying everything I could get my hands on about addiction to really answer the question for me, like, why did this really sweet, good kid start making these choices and these decisions? Mm-hmm. And so I've been able to find a lot of answers to those questions.
That's great. Do you consider substance use a disease?
Definitely. And I actually went to school at a really beautiful time in our history regarding knowledge of addiction, because during the time that I was getting my master's degree, a lot of brain studies were starting to be published that actually identified the place in the human brain where we become addicted. And so we have so much knowledge today that we didn't just 10, 15 years ago about the disease of addiction.
Well, can you help us understand why substance use disorder is considered a disease?
Sure. So there's a part of our brain deep inside our protected lobes that's called the limbic system. And there is a certain regulation that our body does that has to do with the regulation of pleasure. We're constantly seeking pleasure, things that are keeping us alive, that are good for our survival. And there are chemicals that our body makes called neurotransmitters. One of those is dopamine. And dopamine is the primary neurotransmitter of reward. So when we engage in our environment and do good things for ourselves, like eat or be in relationship with people, even smiling increases dopamine levels. But so do substances of abuse, like drugs or alcohol or even technology or pornography or sugar. So many different things spike our dopamine levels high. Mm-hmm. And what happens is those spike too high. And once our neurotransmitters are flooded with too much dopamine, a few things happen inside there. Some of those neurotransmitters are damaged. Some of them are flooded and start to grow more receptor sites to handle this influx of dopamine. And then more and more and more flooding over time actually creates structural changes in our brain. And when those structural changes take place, they don't just magically disappear. They're structural. They're there. Mm-hmm. Once we have too many receptor sites for dopamine, then when all that dopamine leaves the system, your brain starts craving more dopamine. Like, hey, where did that go? I want more of that. And we experience withdrawal symptoms. And depending upon the substance that we use, we can build tolerance slowly or quickly, depending upon how much it floods our system with dopamine.
That's very, very interesting. Can you tell me, do you think that substance use is necessarily linked to other illnesses?
Oh, most definitely. I mean, let's start first with genetics. Because there's a term out there that irks me a little bit. People say, oh, they have an addictive personality. Well, it's really important to remember that anybody can get addicted to substances that spike dopamine levels too high. if we go above a certain threshold. So that threshold is called the hedonic or pleasure threshold. And so people who have a genetic predisposition, their threshold is actually lower than that of other people. And about 1 in every 5, 1 in every 6 people have a genetic predisposition for addiction, which means their genetic threshold is lower. And so when they spike their dopamine levels too high, all they have to do is spike to here, and those structural changes will start taking place sooner and sooner and sooner. And so if somebody starts using when they're younger, and it's interesting because about 90% of adult addicts began using in their teenage years, right when their adult brain is forming between the ages of 11 and 25. We start to grow our prefrontal cortex and frontal lobes, which is the seat of all executive functioning skills. So executive functioning skills govern our problem solving, decision making, our abstract rational thinking, our connection and empathy for other people really happens primarily in that part of our brain. Emotion regulation, frustration tolerance. And so what you see is that because most people start using while that part of the brain is developing, that development gets arrested. And so therefore, what you see as addicts continue to use and grow into adulthood is problems with executive functioning, like learning and motivation. And then you see things like depression and anxiety and other mental health issues may be exacerbated or emerge. It causes a host of problems interpersonally, socioeconomic wise, career, academic choices and decisions. It can reduce someone's IQ by a considerable amount of points as somebody grows and develops. And so it's really rare that I see a client who comes in with just substance abuse problems. They usually have a kind of a host of other issues that have been either caused or exacerbated by the substance use disorder.
Is treatment effective and can it be done?
Most definitely. Treatment is effective and it can be done, but it may need to be done more than once, maybe even more than that. Relapse rates are high, and so we have to plan treatment accordingly. If there was a study done about average treatment episodes, and what they found is that the average American adult addict usually has between 7 and 9 treatment episodes before they actually can finally maintain a long length of sobriety. And that could be over quite a few years. So it does work, but sometimes it takes a long time. Nobody grows up and wants to be an addict. And the human psyche takes time to accept that they are, enough so that they can treat it adequately.
What are the ways that it can be treated?
Sure, great question. So we need to have a really good continuum of care. So what we know is that relapse rates are between 80 and 90% the first 6 months of sobriety. It's really high. When we get to 1 year of sobriety, relapse rates drop down into the 50th percentile, but that's still 50%. And so what we found is that when you get to 18 months of continuous sobriety, relapse rates drop down below the 20th percentile. So there's this beautiful magical thing that happens to a person's brain at about the 1.5 year mark. The stress levels finally reduce, the brain really starts to heal, blood flow and electrical activity start really returning to the frontal cortex parts of the brain, and that person then can start thriving instead of just surviving. So our treatment really needs to be tailored around that 18-month timeline. There are lots of different levels of care. We may start with a detox program, residential treatment for 30 to 45 days, and then a step down into intensive outpatient, then maybe another step into supportive outpatient. And that could be the first 3 to 4 months of treatment. And that supports that person within that really high risk time. And then once they're more stable, they can move into potentially a weekly aftercare type of situation, with meetings and support and therapy that goes along with that. They could continue that on for 6 to 9 months and then step that down to maybe 1 or 2 times per week thereafter. And then when they get to about the 18-month mark, they should hopefully be transitioning into their own community of recovery with ongoing therapeutic individual care.
Everything you're saying so far is so interesting, and I appreciate it. So, can you tell me, what impact does society have on people with substance use addictions?
Being a person in long-term recovery myself, I think because of what I do for a living too, I talk about this all day long and it's so exciting to me. And sometimes I will go into a new group of people and speak just like you and I are speaking, and I get kind of a different attitude, more hush-hush and surprised faces. And that's stigma. I think, telling people I'm an addict, I'm in recovery, some people don't really kind of realize and understand what that means. And so many people out there have had really heartbreaking experiences with family members and friends who were in multiple treatment episodes, and it didn't take for them yet. And so they see what's on the outside, which can be really bad behavior and negative thinking patterns and familial disruption. And so I can understand why there's a stigma. However, helping people understand that it's a disease and that it does take a long-term approach hopefully will reduce stigma that society still carries so much for the disease of addiction.
Okay. Can you tell me, what do you think needs to happen to improve access and outcomes?
Well, the first thing I thought of was money. However, it's quite interesting because as communities band together and support recovery efforts, we could actually create a really beautiful systemic long-term continuum of care. So one of the most promising fields for addiction research is in youth, especially since 90% of us start using in our adolescence. This is where we really could focus some dollars. And Houston is a beautiful community to do that in because we are the home of the alternative peer group, starting with PDAP in 1971. And there are about 6 different alternative peer groups in Houston alone right now that function to support kids in their recovery. So a lot of times a youth may go into treatment, and for the most part, a lot of different insurance companies do pay for that episode. But then how to support a child long term, and they may even need more length of treatment than an adult does. And an alternative peer group is a great place for that, where we actually move a youth into a different recovering peer group and support them. And then also there are recovering high schools. Archway Academy is the #1 largest one in the country, and it's right here in Houston. So if a youth can go to a recovery high school during the day and an alternative peer group in the evenings and on weekends, and be completely surrounded by people who will teach them how to have fun and socialize without drugs and alcohol, it's a great way to start reducing the effect of those numbers that we see in adult addiction. And then, of course, when they go to college, their brain is still growing and developing. And there are now over 75 different college campuses in the United States that have recovery programs, sober dorms, sober sections of the stadiums where they can go and be with their people and have as much fun going and doing that as they ever would have, and even more without drugs or alcohol.
That's good. I didn't know that. Okay, so do you have any closing thoughts for us?
Well, I think that, kind of segued into my closing idea, because when I was 18 and I was in treatment, I really thought my life was over because I didn't have drugs and alcohol to deal with my negative feelings, stress, or to help me have fun. And I really relied on that a lot. I even thought to myself, what am I going to drink on my wedding day? I drank non-alcoholic champagne on my wedding day, and it was such a small part of the whole experience. What I've really learned about recovery and not using is that it can be way more fun than using ever did. is being in recovery. So that's how I'd like to close.
Well, thank you so much for spending time with us, and thank you so much for all the information you gave us.
Sure. Thanks,
Thank
Marina.
you.
Yeah.